All right. So good evening, everybody. Welcome to the Leading Ladies of Logistics July call. We got a treat for you guys today. Miss LaTosha is going to bring some fantastic information for you. Before I turn it over to her, I'm going to turn it over to one of our special guests for this evening. Give her about 5 minutes to talk to you guys about Legal Shield. So, Miss Donna, are you here?
Yes, ma'am. Can you hear me okay?
I can hear you perfect. So everybody, this is Miss Donna. Let's give her your undivided attention for a few minutes, and then we're going to turn the tables over to Miss Tasha. Welcome, Donna.
Well, thank you so much. I appreciate the opportunity to be here with you ladies this evening. I'm so excited about sharing what it is that I do to help commercial drivers and carriers and freight operators, you name it. That's the area that I specialize in, and being able to not only protect you and your drivers, but to empower you with services that can help you to, to help you have business longevity, right? Because that's what we're in it for. We're in it for the long haul. So, as you said, my name is Donna Williams, and I work in the commercial drivers division as well as the business solutions division. And what we do is we provide you and your drivers to have access to transportation attorneys, right? Because we know when your drivers are out there on that road, every now and again they got to deal with DOT, right? And anytime they get a citation or violation, it could potentially affect your CSA scores. And who looks at your CSA scores? Your vendors as well as your insurance company, right? And so the goal is to keep those scores as low as possible. And so by giving your drivers access to transportation attorneys in all the lower 48 states, right? So then they're not limited on on having access. So anytime they're dealing with an issue, simply pick up the phone. They can call into their law firm to help them with it. Whether it's DOT violations, non-moving violations, moving violations, license reinstatement, or sometimes even if they just need to call in and ask questions, about their CS and get CSA consultation. And so that's huge. We also protect them if they ever, God forbid, they're involved in an accident and there's a fatality. They have representation so long as they're driving legally. And what we consider legal is licensed, insured, registered, and not under the influence of any types of drugs or alcohol. So that's one way we provide you and your drivers with solutions. The other way we provide you with solutions is giving you and your family access to legal, right? Because life is a part of what we do every day. And so anytime we're dealing with something, it can affect us while we're out on that road, or could affect your drivers while they're on that road, right? So it could be anything from, any type of landlord tenant issue, or it could be something as simple as just needing a contract review, right? Or just having a question about a consumer issue, finding something on their bill, some sort of tax issue, right? And so the other side of that too is giving them the ability to put in place, or you ladies' the ability to put in place your will, your living will, your health care directing your financial power of attorney, right? So all these services I'm talking about are beneficial to you as well. It also gives you 24/7 emergency access in case you're ever in a situation and there's an emergency. To know that you have an attorney on call gives you the power back in your hand, okay? Another thing that we do to empower you is giving you access to business legal. Like, we all run a businesses here, right? And our goal is to stay in business. And one way to stay in business is to know what your rights are legally as a business. And the way to know that is by speaking to your business attorney, right? Being able to call your law firm. If you have a situation where you have drawn up a contract with someone else and you need them to look over it, ask them to look it over, right? Or vice versa. Somebody's handed you a contract to sign, have your attorney look it over. Those are the things once you put their name on that line that's binding, right? So you want to make sure you're bound to something you want to be bound to. Okay. And the other side of that too is just sometimes we just need to know what our rights are. Sometimes it's something that's hypothetical. We're thinking about doing something. What are my rights? But the other side is, what are my options as a business? Speaking to your attorney could open up doors of options that you didn't even think of. Okay. And so, and the other side of that is knowing that if you do get into a contract with someone and they end up not paying you, or they only pay you a portion of what they're supposed to pay you, who are you going to call? Your business legal attorney. Because your attorney can go ahead and use their expertise to get that money back for you. And the great thing with through our services, our attorneys don't keep a portion of that at all. You get 100% back of whatever they're able to retrieve for you. Okay. And as a business too, that empowers you because now you have the upper hand. You don't have to be no stressing, no guessing, no Googling, right? Because that's what I used to do prior to having the services and was still out in the dark, not knowing what to do. I just pick up the phone now, call my attorney, ask them the questions, get the answers that I need, and move forward, right? And so that's what you have after today. Being able to empower yourselves with that type of service, and your drivers also, implementing those things into your business to help you with your business longevity. And the other side of that too is we have other plans to help you in case someone tries to sue you as a business, right? I had a gentleman one time, poor thing. I had told him about the services, but he waited on it, right? And so guess what? A month later, someone comes at him with a lawsuit. Unfortunately, because he didn't have the money to deal with that lawsuit, he put him out of business, right? And so these things can happen. It's just, and it was a fluke. It was a crazy thing. It was somebody that fell off the back of his truck, right? And so now they wanted to sue him. And so just being able to put in place the things to help us to run our business like a business, that's what I'm here to help you with. So I appreciate the opportunity to be able to share this information. I look forward to hearing from you ladies and connecting with you to be able to educate you further and be able to answer any questions you may have. So I want to thank you so much for allowing me to speak this evening.
Absolutely. Thank you, Donna. And again, I'll go ahead and drop your information in the group, and we appreciate you for bringing the information to us. And if they have any questions, I'll make sure they reach out.
All right. Thank you so much. Have a great one, ladies.
You're very welcome. All right, so let me let the rest of these folks in here so we can get down to the nitty gritty. Miss Tasha got some information y'all need to hear. I'm excited about this information because, of course, I have left corporate America. 2 of my team members this week left corporate America, so I'm so excited. I'm always excited to hear about the corporate America dropouts and all the success stories. So we definitely appreciate you, Tasha. I'm going to go ahead and turn it over to you so you can be a host. Give me 1 second. There we go. All yours, Miss Tasha.
All right, if y'all hear my dog in the background, please excuse him. He's sitting up here just going crazy. He just like the kids. They don't start cutting up until you start doing something. I might have to put him up because he's doing too much. Let me share this. Okay, so I want to make sure everyone can see the PowerPoint. You can just comment in the chat that you can see it. All right, good. So I'll go ahead and get started so I won't keep you guys long. It is a good bit of information, but it's information that you definitely will need if you truly plan on transitioning from corporate America to being a full-time entrepreneur, okay? So just a little bit about me. Y'all already know I'm LaTosha. I own L&J Enterprises. However, we have a trucking company too. And so the trucking company came, before I started my L&J Enterprises. At first, it was perfect. We had the trucking company just rolling. I was not thinking about being a full-time entrepreneur or anything like that. So as time went on, my husband, he always was an entrepreneur basically. Before he started driving trucks, he was a barber. So working for someone was basically never in his DNA at all. So basically on the benefit side, it was basically me having benefits, with the job for our family. When I started kind of thinking about entrepreneurship, I was like, well, dang, I can't leave my job because they got all these benefits. We have 4 kids plus us. So there's 6 people right there that we got to make sure we have health insurance for, dental insurance, vision insurance, retirement plan, life insurance. So all of that. So I was like, I'm not gonna leave, I'm gonna be set up for retirement. Before I started working with the insurance company as a nurse case manager, I was actually working for the state. And if anyone has ever had a state job, typically they are beautiful. I started as a nurse 2009. However, I was working with that state job ever since 2010. 6 or 7, and you could retire after 25 years. So I was looking good at retiring, before I was even 50 years old. So I would have been, perfect. Like, why would anyone want to leave that, right? But as Joe kept talking to me about entrepreneurship, I was like, it gotta be a way for me to, look at these benefits and stuff. So that's kind of how my journey started. Benefits was really holding me hostage. That was truly the only reason why I was holding on to my job, was for benefits. Little did I know I could create my own benefits package, okay? And you guys can too, and I'm gonna walk you guys through that. So just a little bit about me. Like I said, I'm a registered nurse. I continue to keep my license, so I will always be a registered nurse. I was a insurance case manager in the latter part of my career. I have multiple transportation companies, plus I have a healthcare staffing agency. So now, with the transportation company, at first it was just me. Then I hired independent contractors where I didn't care or have to worry about basically their insurance. However, with my staffing agencies, tables have turned. And so now I have to worry about their, not only like workers' comp insurance, but also I have to worry about health, dental, vision, all that for them too. But today I will talk to you guys in the aspect of just making sure you and your family are covered, okay? So we're gonna chat about health insurance, dental insurance. Let me let these people in. Health, dental, vision insurance, retirement, and life insurance, okay? Those are gonna be our topics. So with health insurance, you have many different plans that you can choose from, okay? So remember I said, being in the insurance arena, I basically knew, okay, this is how my insurance is going to be set up. I'm not going to have any problems getting my insurance, getting coverage for the family. I knew exactly what to look for, blah, 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 blah. Y'all, when I started reaching out to companies for insurance for my entire family, it was a total new ball game versus me looking at plans with my employer, okay? Now I'm in the position of the employer, basically self-employed starting out. So I was responsible for all of the insurance coverage. So your employer, if you don't know, your employer actually pays a portion of your insurance. So when you are stepping out on your own, you will be responsible for that portion, okay? Right now, our insurance for the 6 of us, just health insurance, is almost $700 something a month. And I will tell you guys why, and I will tell you guys some things to look for when you're looking for plans. So what I started off doing initially, I wanted to keep the same insurance that I had. I was working for UMR, United Healthcare, but I was working on the private sector. So, I'm just gonna call them and tell them, I wanna get a plan as an individual. Y'all, I called those people, and lo and behold, on the private individual sector, the insurance companies do not have to follow the Affordable Health Care Act regulations, basically Obamacare. They do not have to follow those regulations. So pre-existing conditions, they don't cover that. They didn't even cover if I was to get pregnant again. I'm not getting pregnant again, but they didn't even cover that. Our twins, they were preemies, so they have to go to the doctor a little bit more often than their annual appointments. And so none of their stuff will be covered. My oldest son goes to the dermatologist about every 3 months. His stuff wouldn't be covered. So it was just like, okay, well, maybe this is is not so good. So after calling a couple of different insurance companies finding out the same thing. I was like, so what do I do now? So did some more research. And so I reached out to an insurance broker that actually my beautician, she went through. So this particular broker, she basically only did the Affordable Health Care Act plan. And me personally, since I was already in the insurance arena here, I'm in Mississippi. Here in Mississippi, there are only 2 companies that actually dealt with the Affordable Health Care Act plan. A lot of providers did not want to take the Affordable Health Care Act plan because of payment situations. And I knew that like firsthand. So that was my main reason for saying, well, no, I don't want to, go through there. So what I had to do and what you're going to have to do, you're going to have to start off doing that research, okay? You have to know what your pre-existing conditions are, if you have any, if you plan on just insuring yourself versus your entire family. You have to reach out to your current providers to see if they actually take whatever insurance that you're thinking about getting. So the pediatrician, all 4 kids have the same pediatrician. So I contacted them to see if they accepted the insurance. They did. So my next step was contacting each one of my kids' specialists to verify that they actually accepted the insurance. Now, in my particular case, for me personally, I only have my GI doctor and my PCP, my primary care doctor, and my OB/GYN doctor. So I only go see them once a year for my routine physical. If need be, if they did not accept that insurance, me personally, I was okay with paying out of pocket for those doctor visits because I had been going to them for so long. So that is a personal decision that you have to make. But starting off, what you truly have to do is just jot down, okay, do I have pre-existing conditions? If I do have pre-existing conditions, will my current insurance company, because whoever you're with currently, they will have COBRA for you. You can utilize COBRA, but it will be at a more expensive rate. That will be where you will be able to continue to keep what insurance you have for a certain amount of time, but it's really expensive. I really don't recommend anyone getting COBRA because you can go out and get your own plan. So you have your high premium, low deductible insurance. You have your low premium, high deductible. Okay, so the difference between those, your high premium, low deductible, basically you will be paying a lot of money monthly. So your monthly premium will be higher, but you will have a low deductible, meaning, let me let these people in. So your deductible, I'm sorry, y'all, hold on. So your deductible is actually what you have to meet in order for the insurance to fully start kicking in. So most insurance company will say until that deductible or out-of-pocket maximum is met, they'll pay a certain percentage. It's usually 80-20. Some insurance plans, it's 70%, 30%. Usually the larger percentage is what the insurance company will pay after that deductible is met. Okay, after that deductible is met, that is the key. Now, a lot of people will see, especially with the Affordable Health Care Act, a lot of people will see the low monthly payments, but the deductibles are like $8,000, $9,000, okay? So you have to look out for that. Now, I used to think, well, I don't have any issues. I really don't, use my insurance except for my preventative measures, meaning just my once a year appointments. I'm good. This happened maybe I'll say probably about 3 years ago. I ended up getting sick with a stomach ulcer. And so I had a high deductible plan. I had a high deductible plan because I didn't go to the doctor, I didn't get sick or anything like that. I only went for my preventative stuff. And y'all, my hospital bill was extremely high. My deductible was like $7,000. It was no way that I was going to meet that deductible. Okay. So you always, when you're looking at insurance plans, you always want to look at those deductibles versus premium. Yes, it looks good just paying that low premium every month. But if you look at that deductible when it's high, then that means you're still going to have, if you go to the hospital, most likely you're going to be paying majority of that hospital bill. Okay. So those are things you truly want to look at, your premiums and your deductibles. Okay. Like I said, those low monthly payments are nice, but if something happens, you will be responsible, for the bulk of that payment. So next you have your copays. Now, not every insurance plan will have copays, but some do have copays, like when you go to the specialist or even when you go to your primary care doctor, and the copays can vary. Just make sure when you're looking at that, make sure you look and see what your copays are, and they will be in different sections. The other thing with copays do not go towards your deductible. Okay, they're standalone. Okay, so even though you meet your deductible, most insurance companies still say you're still responsible for that copay at the doctor's office. Okay. Your out-of-pocket maximums, I kind of touched on that. So your out-of-pocket maximum is the dollar amount the insurance company says that you have to pay before they will fully kick in 100%. Okay. Until you meet that out-of-pocket maximum, then you guys are on whatever split, whether it's that 80-20, whether it's that 70-30, whatever your split is, you're still on that. And you remember that split doesn't truly kick in until whatever your deductible has been made. So when you're searching for your insurance plans, these are all things that you need to look for. Next is your in-network versus out-of-network. A lot of people don't think about this one, okay? In-network versus out-of-network. That was the other reason why I contacted the providers that we were already going to, where the kids were already going to verify that they took their insurance and that they're actually in-network. Now, me speaking from a insurance case manager perspective, you can look online of whatever insurance company you're with and see if the providers are in network. However, that does not mean that the provider is going to accept the insurance. Okay. We had that happen plenty of times where on our list, it says that the provider is in network. However, when you contact the provider, they'll say, well, I don't take XYZ insurance. Okay. So when you're sourcing your insurance out, if you already have a provider, yeah, you can check on the insurance company website, and every insurance company has this, and you do not have to log in to actually see this. This is like public information, okay? This is nothing that you have to have a secret code for or anything like that. It will usually say in-network providers, and then you just go and search for your particular provider. Make sure you contact that provider directly too to verify, because you do not want to get whatever insurance thinking that your doctor is in network, because that's what it said on the insurance site. And then lo and behold, when you try to make your appointment, they don't take the insurance. Okay. Next is preventative care. So all of us on here are women. So we know that depending on what age you are, of course, you got to have your yearly just with your primary care doctor. Then you have to have your appointment with your GYN. You have to have your appointment if you're at that colonoscopy age. You have to have that appointment for your mammograms. All insurance companies sees those as preventative care, okay, depending on what age group you're in, as preventative care, okay? So usually preventative care is covered at 100%, okay? So those are one of the things that you really don't have to factor when you're truly trying to figure out which insurance company to go to, because most insurance companies have preventative care. The thing with the preventative care is you will have to look at their specific age requirements, but most of them operate on a standard age requirement. With our GYN exams, some insurance companies, I think it's probably been for the last maybe about 2 years now, have actually started saying you don't need a actual pap smear every year. Some of them are saying they will only cover it for every 2 years or even every 3 years. I saw somebody that said something about 5 years, but I'm not too sure how accurate that is. But what most GYNs have been doing, you will still get your regular pap smear, but they will basically just code it, as a different way. The next thing is prior authorization. So a lot of people don't know about this, but sometimes if you have to go see a specialist, before you can see that specialist, your primary care doctor will have to send a referral over, verifying that you truly need to see that specialist. A lot of insurance companies now, because they are holding their purse strings really tight, are requiring prior authorizations on a lot of things. And this is with medications too. With my son's acne medication that he's been on for a year, just about 2 months ago, they actually started requiring a prior authorization. So what I suggest that you do, if you know it's not a routine medicine, like if it's not just a regular blood pressure medicine, if it's something that's kind of up on that tier level, meaning it's not standard, not everyone, might take it. Like not everyone is going to take that acne medicine, but you have a lot of people that's on blood pressure, cholesterol medicine. So most of those aren't going to require a prior authorization. So if you know you have medications like that, when you're sourcing for your insurance company, you need to look at their medication list, because all insurance companies have approved medication list, okay? And the medication payments, how much they will pay for it, is basically the same thing like your premiums, okay? And your out-of-pocket max, your co-pays. Medications still fall under that same thing. Now, some insurance company, when you pay for your medicines, they will actually include it in your deductible, but not all of them will. So if you know that you're on a lot of medications, then you will have to look at that, okay? Hold on. So you will have to look at that for your medications. The other thing is you don't always have to use your insurance to purchase your medications. I can speak that sometimes it's cheaper to get your medications to pay out of pocket for them rather than to use your insurance. My son's acne medication with using my insurance is like $300 something. But when I use this program called Good RX, that's GOOD RX, then it's just like $100 something. And at that time, like our insurance was really good, but it was cheaper for me to actually use that Good RX. And being a case manager, I would actually give my clients and my patients that Good RX website to go on to any medication. So even if you don't have insurance right now and you need a way to pay for your medications, Good RX is a really good site to go on to. And what it does, you put your medication in, whatever your dosage is, and it actually lists all the pharmacies in your area, and it gives you the prices for all the pharmacies. So that's actually a good resource for you. If you have insurance and your medications are just really expensive, go ahead and look on GoodRx to see if you can get something cheaper, okay? So you do have alternatives to health insurance. If it was only me and it wasn't the kids, I would probably look at some alternative measures. You have telehealth. You also have direct patient care services. And all these have lower monthly payments. For my staffing agency, I actually connected with a nurse practitioner in the South Haven, Memphis area that actually does direct patient care services, where she will be their primary care doctor. And I believe it's just like $65. $65 a month, but you have a primary care doctor that can do your annuals. If you have any needs, they do virtual visits. So that is an alternative, and mostly all states will have a direct patient care service, and they have physician assistants, and they have nurse practitioners. But the lady that is going to do my company, she is a nurse practitioner, and she will basically be their primary care doctor. So that is a health insurance alternative. So if you don't have any pre-existing conditions, or even if you have blood pressure that is managed, that is well maintained, and you truly don't, go to the doctor, this is a good alternative for you. Okay, so you don't have to worry about trying to find actual insurance. This will be something that will be good for you. Now, telehealth, it's basically virtual visits too, where you can contact the doctor. Telehealth visits, depending on which company you go through to get it, a lot of them are per visit, so you'll have to pay per visit for a telehealth. Okay. So next is dental insurance. It's basically the same thing as your health insurance, but for dental. They have different plans set at your high deductibles, low deductibles, high premium, low premium, okay? So you will have to determine which one is going to work for you. You're basically going to do the same thing that you do with your health. You're going to see what does your mouth need, okay? Of course, your preventative and diagnostics are usually covered at 100%. The least I've seen the diagnostics covered at is about 80%, but preventative is usually covered at 100%. That's usually your 6-month, screenings, cleanings, those things. Then you have your restorations, oral surgery, endodontics, and those can get, kind of pricey. The oral surgery, a lot of people don't think about this, but when you're going to have a tooth removed, they actually bill that as oral surgery. So whichever insurance, dental insurance plan that you get, you need to make sure you literally dissect it and see what your needs will be, okay? Because dental insurance is one of them that can actually get costly, okay? So you want to basically do the same thing that you're doing with when you're searching for your health insurance. You want to make sure that you do that with your dental insurance. Now, with the health insurance, Delta Dental is a popular one, but you will be looking at their individual plan, but they are a popular one, and you just have to see which one fits you best. Now, the Affordable Health Care Act, they actually have some dental plans too that you can look at that aren't as pricey, but you have to look at what is all covered, because like this oral surgery, the endodontics, the restoration, some of those are not covered, or if they are covered, they are really expensive. Okay, so with the dental insurance, you truly want to shop around. You want to shop around on that. The easiest thing for people that are not in the insurance field to do is to basically get if you are not comfortable with doing it on your own, you can get an insurance broker. My information is in the group. You can also send me a message if you need some help, looking over some of those plans and stuff too, okay? Because the insurance world is very, very tricky. So vision insurance, to me, that's the easiest one. If you don't have any pre-existing conditions, it's cheaper to pay for your vision insurance out of pocket. We don't even have vision insurance. We only go once a year, and we actually go to the Walmart actually has a vision center that we've actually been going to for years. The out of pocket is only, I believe it's like 80 something dollars, and that's here, but it's 80 something dollars per person. And then depending on who needs glasses, thankfully only me and my oldest son actually, well, Joe needs glasses too. Joe got glasses, but so it's just 3 out of 6. So we half and half with with needing corrective lenses, but it's cheaper to pay out of pocket. Now, if you have pre-existing eye conditions, then you might need to go ahead and get some vision insurance. But the good thing with vision insurance, depending on the condition, it can be claimed under your medical insurance, okay? So that is a good thing about having, if you do have an eye condition, you can try to get it claimed under your medical insurance, because at that time you're not going to a regular doctor, you're going to a specialist. Okay, so next is retirement. And I know a lot of people don't think about retirement. The only reason why I was thinking about retirement is because I knew that I only had to work 25 years and I could retire. But a lot of people don't think about the retirement. Now, for those that do not have state jobs and have regular jobs, most jobs give you, well, some of them automatically opt you in, and some of them give you the option of opting in to their retirement plan. A lot of companies use Fidelity. My insurance company that I was with prior to swapping out was, they use Fidelity. So I actually had a CPA. Well, she was the CPA for the trucking company, but I told her what I was trying to do. So she actually gave me some advice on swapping everything out. However, she told me that all of those finance companies basically have it where you can contact them and get a financial advisor just about your particular account. They're not going to give you a whole lot of stuff, about your goals and all that. They're just going to talk about that current specific account. So I called Fidelity and actually was able to have my group account basically that was set up converted over to an individual account. So a lot of people go on and pull their money out. That's a personal preference if you want to do that. But if you have retirement with your current job, check directly with whoever the company is that's holding the retirement money to see if you can convert it over to a individual account. Okay. The other thing is you have people that will convert it over to different like IRA accounts and all of that. I really say if you're going to be converting over to different accounts like that, be sure that you speak with a CPA, because when you start exchanging monies and flipping money and stuff, then you're looking at most likely getting taxed some Like with my state job, if I pulled it out, I would have gotten taxed twice. I would have gotten taxed pulling it out. And then when it was time to file taxes, I would have gotten taxed again. Okay. So you always want to do your research. And usually if you have a state job, you need to reach out to your human resources department to see who that exact plan is through. And you can call that plan directly if you don't want to, tell human resources, what you're doing basically. And like I said, most companies will have that financial advisor that can help you plan. I know at Fidelity, they will actually, you can basically take the survey basically, and you can put down like what you want to do in 3 years, 5 years, and they'll help you with your financial goals. Basically, they'll tell you like how much you need to save, how much interest you'll accrue, all that good stuff. Okay. All righty. So life insurance. This is a hot topic that a lot of people don't like to talk about, but it is very much needed no matter what industry you're in. So bottom line, get your own policy. So your not your insurance company, but your job most likely offered you life insurance. If you took it, that's fine. Typically when you leave, you will not get that. Some of them do have it where you can convert it over to your own, but you want to do your research on it first. The one that I had with my previous company, when I looked at converting it over, it was not worth it. So look at getting your own life insurance policy. They have different terms. So what you will have to do is look at what's best for you. You have term, you have whole life, you have a lot of different ones, but you have to see which one works best for your situation. Okay. But life insurance is just a no-brainer. You need to get your own. Me personally, I don't feel that this is something that you need to skimp out on. If it's one insurance that you need to have, you need to make sure you have some life insurance, especially if you have children, a husband, you need a spouse, you need to make sure you have life insurance. So, do we have any questions? I'm proud of myself. I try not to make this long. So I'm actually proud of myself for not making it long. Okay. So, do you guys have any questions or anything? Let's see. Okay, let me look at the chat box. Oh, you guys are welcome. You guys are welcome. And like I said, if you guys have if you guys start looking and you actually want to go through some scenarios or looking at your deductibles and all that, just let me know. Yeah, Tia, I would just go ahead and go through an insurance broker if you don't feel like dealing with this. Like literally when I was starting the research, literally it probably took me a good 2 months just to look, because you have to see what insurance companies cover your area. You have to look and see what insurance companies cover your area. You have to see what doctors are in network. So it actually takes a good little while to it actually takes you a good little while to do that. But the insurance broker, once I finally said, let me just get me an insurance broker, they actually, she basically had everything laid out for me. I just had to look at the plan and see what fit my needs. Now, me personally, I just took charge of doing all that. She was there to kind of guide me through it, but being that I was already in the insurance arena, I basically just took charge of that, and she basically gave me she basically just gave me the rates and let me look through everything. Now, I can say looking through those deductibles and what's all covered and the percentages and stuff, it really does get frustrated. So yes, I can definitely refer you to an insurance broker. So the health insurance brokers, oh yeah, let me tell y'all this right quick. So with insurance, you will hear a lot of people, and I only started noticing this when I actually started really looking at these groups. A lot of people will say you need insurance that travels with you. All your insurance travels with you. Okay, so the only thing is, so let's just say if you get in an accident, so I live in Mississippi, I'm in Louisiana, and I get in an accident. My insurance is still going to cover it because that is an emergent event. Okay. So if I live in if I live in Mississippi and I'm just going to Louisiana because I want to go to this certain doctor, no, the insurance company is not going to cover. So some insurance brokers use that as a catch line. Make sure you get insurance that goes where you go. Your insurance goes where you go anyway, even if that provider is not in network, that provider will get a prior authorization basically, because you are now in an emergent situation. Okay, so you'll have to go there. So don't let people say or try to stick you down and say you got to get them that travel with you. All of them travel with you. Remember, I work for the insurance company. I had to look at all these claims. So the way that you will find insurance brokers, now the way I found mine was actually through my beautician, but the way you can find insurance brokers, go onto the healthcare.gov website, and they actually will give you a list of insurance brokers if you need one. And I can actually send you guys the information for that too. I can post it in the group. That way you guys can start looking. And the healthcare.gov, the Affordable Healthcare Act site, they actually have it where you can just like plug in your numbers and get a preliminary, like how much your insurance might cost. Okay, just remember you have those low premium, high deductibles. I pulled one up right before the meeting. I saw a very low premium, but that deductible was $9,000. It is very rare that anyone without pre-existing conditions is going to meet, and this is per person. It's very rare that someone without pre-existing conditions is going to meet 9,000.
That's that, but it's almost over.
So let's see, does anyone have any other questions? And Shanika, so the other thing that you can do, if you don't mind, you can actually see if your children qualify for Medicaid. You can see if your provider actually accepts Medicaid, and you can actually try to apply for Medicaid if you don't mind doing that. That way the kids can have coverage too. So you have a lot of different options out there. Just let me know if y'all need, help with it and stuff. And y'all feel free to reach out. I love talking health insurance because as a nurse, health insurance was one of the main things that tripped up a lot of my a lot of my customers, well, I call them my customers, Lord, my patients, they just didn't understand how to navigate the healthcare system. And my background is oncology, is cancer. So y'all know a lot of those people did not know how to navigate the system. So um, if y'all need anything, feel free to make outreach to me. I am going to turn it on back over. It has been a pleasure assisting you guys.
Super, super dope. Thank you so much, Tasha. We really appreciate you bringing all that information to us. Very, very helpful. We appreciate you guys for tuning in this week. We got about 5 good minutes. So we're gonna do a kind of like a Q&A, open discussion. If anybody has any questions about anything, this is your opportunity for 5 minutes. Don't make these no long drawn out questions. But if y'all have any questions about anything, drop your questions in the chat. We're gonna try to get some questions answered for another 5 minutes. So any questions, you're getting started, you got some trouble with your services or whatever the case may be, any questions that we can answer. We do have a few mentors on the line. So any questions that we can answer, either raise your hand or drop your questions in the chat. We can go ahead and take care of those in the next 5 minutes. Also, with this info help our carriers too? I would think so. Tasha, she's asking, would this information help our carriers too?
Oh, most definitely. All of your carriers need insurance. As a truck driver, they need insurance. If they do not have insurance, at the bare minimum, they need to have that direct patient care monthly subscription, but they absolutely need to have insurance. A lot of them, what they do, they just pay that every 2-year fee to go to that DOT approved physician just for their physical, but they don't get checked on in between time. And some of them slide the doctor or nurse practitioner or nursing assistant some money to have that blood pressure documented at a lower rate. But they should look. I know a couple. So definitely truckers need to have insurance. At bare minimum, they need to have that direct patient one too. But they absolutely, when I say absolutely need to have insurance, they really do, because truckers are actually are very prone for getting sick. They can get blood clots. They don't eat well, so they're at higher risk for heart disease, hypertension, all that bad stuff. And they can stroke out. I had a customer, her driver actually had a stroke on the road, but it just goes from truckers not taking care of themselves and literally only going to the doctor when it's time for them to get that physical.
Wow. Yeah.
Yeah, most likely so if you go through the Affordable Health Care Act, they don't care about your pre-existing conditions. But a private insurance company right now, they're telling people they're not even going to cover your pre-existing conditions. So you can get on with their insurance company, but anything you had previously, they're not going to pay for it. So that doctor's visit, those medicines, they're not covering it. It doesn't matter what the pre-existing condition is. They're not going to cover it. But that's on your private sector. But let's just say if you plan on having group insurance, meaning you're going to cover yourself, plus you got some employees, then now you turn into a group. And you will actually be covered under the regulations of the Affordable Health Care Act. But you seeking out coverage as an individual, we kind of getting screwed right now as individuals, basically, unless you sign up with the Affordable Health Care Act, aka Obamacare.
Okay. Any other questions? Nope. Well, all right. Well, if we don't have any more questions tonight, again, we definitely appreciate Donna Williams for being here, and definitely appreciate LaTosha for being here and bringing us these wonderful gems tonight. We appreciate each and every one of you guys for tuning in to us every month. We'll have our August call posted really, really soon. That's it. We appreciate you guys, and I hope you have a great, great, great evening.
Thank y'all. Y'all take care.
Thank you, you too.